So the bevel position when doing an ultrasound guided injection is really important. We need to understand how to see the bevel accurately, but also how to understand whether it's facing up or down when performing an injection technique under ultrasound. And this has particular relevance with some injections. So for example, here the subacromial subdeltoid bursa, the needle here, the bevel is facing up. And as a result of that, it's quite possible sometimes for the injectate to be superficial to the bursa itself. If the bevel is facing down, as shown here, then it's more likely that the injectate will go accurately into the bursa with little resistance. You can see here, this is a nice image here of the bevel facing down and of the bevel facing up. And this will also help you understand and reduce crosscut artifact as well. And there'll be a further video on that. You can see here, spinning the syringe changes the orientation of the bevel facing up and facing down.